to my friend Janelle Lakman. She's my partner in crime on this. And thanks to her, everything is spelled correctly on this presentation, whether I can pronounce it or not. My name's Jenny Ray, and we're members of the Stone Massage Association in addition to having a CDU company called Stone Medicine. We started out developing this for the stone industry because two spas, well-known spas, one in Greece that's part of the Mandarin Oriental hotel chain, were put out of business because MRSA got loose in their spa and they could not figure out how to get it out, and they could not get it cleaned and all that, and they ended up closing down the facilities. The government closed them down. All of it was traced back to stones. The stones weren't being cleaned well enough. And many times when we go to teach at different spa locations, we'll find unhealthy, unsafe practices with the stones. So that's where it began. We started looking into what's changed in the industry. Why is MRSA such a difficult problem? I mean, we've all heard of it forever. We've all known it's there. We all wash our hands. We all do the Sani stuff. We all know all that. So we're trying to figure out what had changed, that all of a sudden it was a big problem. And that's what led us to do this research project. Now we recognize that, of course, we're way beyond just stones. You know, there's bamboo, there's coupling, there's thumbs, plastic, wooden, all kinds of tools, shells, many, many things that this applies to as well. So in that discovery of something happened to be done, we pulled this project together from many different resources. So we'll just get into it. I appreciate so much you guys taking the time to come, because I know this isn't like a hot topic. There are so many fun things to do here at the festival, and amazing classes to take, and really interesting, that are exciting. And this is just kind of the guts and nitty-gritty dirt work. So I really appreciate you taking the time. It's amazing. So we'll get on with the project. And this research resources that we've used is the Centers for Disease Control, Johns Hopkins University, the Johns Hopkins Magazine, Johns Hopkins Burn Center. Cornell, of course, is a very famous medical school, New York Presbyterian Hospital, Alta Bates Burn Center, and the Stone Massage Association. We recognize changes in the current data as it relates to infectious disease and develop appropriate sanitation procedures. We need to publish new research results for access by the general public as well as the professional, to protect the client through this education and remind professional practitioners of necessary safety criteria as it relates to temperature when used in various therapeutic modalities. So our number one topic of sanitation: explanations of current data on communicable skin disorders, infections, viruses, and diseases, sanitation protocols, and approved product recommendations, all compiled from the CDC research. Our objectives is to understand and be able to apply safe hygiene and sanitation practices, understand the proper methods of safe sanitation of massage implements and equipment, have a working knowledge of the current risks for infectious diseases in the massage industry. Data compiled and integrated by the International, we just told you that, Johns Hopkins Medicine. As organisms go, a bacterium could not be simpler. One cell, no nucleus, a membrane surrounding cytoplasm, some protein synthesizing ribosomes, and a single loop strand of DNA. That's it. But if you study bacteria, it becomes hard not to think of them as possessing agency. They are obstinate, they are insidious, and they are ingenious. And says Karen Carroll, director of microbiology at Johns Hopkins Hospital, they're always one step ahead of us. Each time researchers developed a new class of antibiotics, pathogens developed resistance. It was as if the antibiotics had hit the evolutionary gas pedal. No sooner did science develop penicillin, the first antibiotic 60 years ago, than bacteria began demonstrating resistance to it. MRSA is but one of several drug resistance and pronunciation resistance, so hang on, I'm going to stumble. Pathogens. VRE, you can see what that stands for. A particular problem with transplant patients.
Vancomycin.
Thank you. Who have compromised immunity, and C. diff, which can induce fatal diarrhea, multi-drug resistance, and there's a whole group of them: Acinetobacter baumannii, vancomycin, intermediate resistant Staphylococcus aureus, visa. Currently rare but worrisome. These are germs that can live in many places, but mostly for the past 50 years they've been confined to hospitals, clinical or confined residential care facilities, where they have become a menace. For years, scientists, physicians, and the public have regarded increasingly prevalent drug-resistant infections as a hospital problem. That's where dangerous microbes like VRE and MRSA lurk and spread due to cross-contamination and ideal living conditions. But then hospitals began to report more and more people who had never been near a healthcare facility coming through their doors, already colonized by resistant bacteria. Where were people picking up bugs like MRSA, which now kills more than 20,000 people a year, more than die from AIDS? MRSA is quickly becoming the #1 health threat in the U.S. CA MRSA, that's community-associated MRSA, outbreaks rising in alternative and complementary healthcare facilities. MRSA was recently discovered in cow's milk and blood samples. Methicillin-resistant Staphylococcus aureus, MRSA, is rapidly evolving as a pathogen of special interest both in the hospital community, and Cornell is involved in the investigation of rapid identification methodologies for MSSA and MRSA directly from blood cultures. Such approaches may lead to more rapid diagnosis of such infections with earlier initiation of appropriate antimicrobial therapy. MRSA has tended to colonize the inside of the human nose and the skin in warm, moist places like the armpit or groin. 30% of people walk around with MRSA bacteria in their noses and suffer no ill effects. But if it gets past the barrier of the skin through injury or incision, it can cause no end of trouble. Boils, styes, urinary tract infections, impetigo, pneumonia, sinusitis, mastitis, phlebitis, meningitis, osteomyelitis, endocrinitis, any other itis that you might be able to think of, septicemia, and toxic shock syndrome. Before the advent of antibiotics, if MRSA entered the bloodstream, the patient had an 80% chance of dying.
20% chance of survival.
Ridiculous.
And the complications during the rest of your life is it's phenomenal. You always have greater chances of eruption of a variety of those itises for the rest of your life.
Last October, this was in 2010, the Journal of American Medical Association published a startling study of data with 9 U.S. cities and estimated that in 2005, MRSA caused serious invasive infections of 94,360 patients. 20% of them died. If the estimates were accurate, that meant MRSA killed or at least contributed to the deaths of more people in 2005 than HIV/AIDS, Parkinson's disease, or emphysema combined. In the days following the JAMA report, newspapers quoted epidemiologists saying things like, "It is astounding and we should be very worried." This is the simple description of where it got its name. The bacterium's name comes from Staphyla, grape cluster, coccus berry, and aureus golden. Through the microscope, it looks a bit like caviar. For 3 decades, the problem with drug-resistant pathogens had been almost entirely confined to hospitals, according to Johns Hopkins. The pathogen now appears to be loose in the community. Epidemiologists began gathering and studying data on the community-acquired infection called MRSA in '99. They found that congested cities with large populations and the urban poor in Detroit, Atlanta, Baltimore, and Chicago reported high rates of staph infection. It's been documented at Bayville Memorial, where estimates of 25 to 35% of the outpatient visits to the infectious disease clinic are for recurring cellulitis caused by staph infections. CA MRSA is not for the poor and congested population alone. One day in 2007, Ashton Bonds, a healthy 17-year-old senior of the affluent Stoughton River High School in Virginia, right here in the backyard, complained of pain in his side. 12 days later, he was dead from MRSA-induced multi-organ failure that destroyed his kidneys, liver, lungs, and heart. That same month, a preschool child in New Hampshire, Catherine Bentley, and an 11-year-old, Shay Kiernan of Mississippi, died from CA MRSA infection. For a week or two last October in '09, it was hard to find a local daily newspaper that did not have a front-page story about drug-resistant staph. Reporters dug up earlier reports, less noticed at the time, of staph infection outbreaks among football players at the University of Southern California and members of the St. Louis Rams in the National Football League and the Boston Celtics of the National Basketball Association. Now all of a sudden these are people that are on our table. These aren't people that are in hospitals or clinics, and we are seeing them. It's been about a week, two weeks before I left for Virginia that the staff infected person came in. Is that right? Mm-hmm. We had a client who works with elders came in and she thought she had an allergic reaction to something while at a stand. I mean, it was solid. Covered. And she is under heavy-duty medical care. We live in Podunk, Washington. I mean, there's nobody that lives out there, so it's everywhere. Obviously, you've seen some of these images maybe in school before. It can look so different in different people. The outbreaks don't always look exactly the same. It's a little more difficult to recognize. You might think someone just has a pimple or a boil and avoid that area and find out later that it's actually gone into a serious staph infection. And of course, the one on the lower right is after it's broken in through some of the main tissues that are going to cause a lot of problems. Medical research has proven this deadly infection is in our community, and we know that the skin is the largest organ of the body. We know the massage practitioners touch more skin than any other healthcare provider. Conclusion, professional massage practitioners are most at risk of contracting and or cross-contaminating clientele with MRSA and other deadly skin-related viruses. Assumption, prevention measures must be implemented to protect the clients and practitioners. Insufficient and outdated sanitation practices will result in mass contamination through the massage industry. Innocent clients will be harmed, practitioners will be infected, insurance costs will skyrocket. Now's the time for action. The first step, you're here. You're finding out if there's anything new that you need to know about. New precautions are in place and new sanitation systems are available. So let's move into some solutions. The CDC was quite interesting the first time I contacted them. I'm going to tell them what they told us about the stones.
Talk louder.
No, I don't.
So quick.
Both of you.
Yeah,
You're not reading to yourself, okay, to us.
Okay. In last year when we were pulling all this together, I contacted the CDC and asked them, what is your best recommendation for sanitizing stones used in massage? And they sent back, please contact the manufacturer. That would be Mother Earth. She don't talk to even me. You know, it's like, hey, so how is that going to work? They had no clue that we were even using actual real stones from the earth in massage. They just didn't have any idea. So then they began sending us information on other items that would come in contact with the skin. So this is the research that they presented with us with. As with other germs, staph and MRSA can survive on some surfaces for hours, days, or even months. It all depends on the factors like temperature, humidity, the amount of germs present, and the type of surface. So the Stone Massage Association says, is it porous like a stone, bamboo stick, massage pillow, plastic thumb, wooden massage tools, or your own hands, or non-porous like cupping glass? It all depends on whether these surfaces have nutrients to allow the germs to survive longer, such things as massage oils, especially high-protein nut or seed oils, lotions, skin cells, and dust provide nutrients. When surfaces aren't cleaned and conditions are good for bacterial growth, staph and MRSA is more likely to survive for longer periods. Simply rinsing items in hot water and letting them sit for a few minutes between clients is no longer an effective preventative measure. What can you do? You learned a lot of this in school. I'm sure you teach it to your students if you're an educator. Never work on a client with an open skin lesion. Never work on clients when you have open skin lesions or rash that cannot be sealed completely. Cover any open skin sites with sterile dressing. Covering with secure bandages is the best way to keep skin surfaces from becoming contaminated with staph and MRSA. Wash your hands often with antibacterial soap and water, or use alcohol-based hand rub with a sink when a sink is not available. Always clean your hands after touching any skin and before touching surfaces. Regularly clean frequently touched surfaces and other items that come into direct contact with human skin. Even healthy skin can be a carrier of staph and MRSA. Always sanitize each surface or item between clients to avoid cross-contamination. In gyms, locker rooms, massage areas, and other places where many people come and go, repair or throw out equipment and furniture with damaged surfaces that cannot be thoroughly cleaned. Be cautious of items with porous surfaces, as they are most difficult to sanitize. Any item, product, or surface that is used for facilitating therapy must be sanitized between each client.
And for the people who teach classes, you've got a large room and you're going, helping people. figure out what to do with whatever stroke it is. We just touched Jane Doe, and then you're going to go over here and help this person. You're cross-contaminating. So they have little jars of the antibacterial stuff that you can just wipe on between. So that's something also to remember to do when you're helping people, is to, oh, I just, worked on this person for 30 seconds, not even that, but you have that opportunity to be doing some cross-contamination. So that's something to also be remembered as you're teaching.
And that's one that taught me. Now I try to run around. I've got a holster with the pump sanitizer and a holster with the oil, and I always have the wrong one.
Yeah, let me clean my hands.
I can do it again. And that's something that none of us had even considered. You're in class with healthy massage practitioners, but
you don't know. You don't know who's a carrier. You don't know.
Did they say anything about which type of water, hot or cold water, was better for sanitizing hands?
Hot water. Or it has to be below 30 degrees, which is it's already frozen.
Ice.
It's like by the time you get it iced, it's no longer liquid. So that was part of what surprised me. I thought all this time that when I was chilling my stones, because we'd keep them about 30 to 32 degrees, they're not sanitized. I had to clean them with alcohol before that. So that it has changed my thinking on a lot of stuff. I really thought I was quite safe by washing with soap and water, and I use a good antibacterial soap, just rinsing stuff off and drying them and putting them back in. I wasn't putting anything in the water or doing any of that stuff. So they've given us quite a bit of information here. Focusing on surfaces that touch people's bare skin, for example, surfaces such as, they gave me the whole package and we're kind of obligated to use it because that's how they wanted it. Such as benches in the weight room or locker room, linens on massage and therapy benches, gym equipment, therapeutic manipulative tools, such as vibration units or traction devices. Large surfaces, such as floors and walls, have not been directly involved in the spread of staph or MRSA. There is no evidence that spraying or fogging rooms or surfaces with disinfectants will prevent staph and MRSA infections more effectively than the targeted approach of cleaning frequently touch surfaces within and any surfaces that may have been exposed to infections.
Like fixtures, those sort of things, doorknobs.
Yeah, things we never thought about before, never considered. And the difference between cleansers and detergents are products that are used to remove soil, dirt, dust, organic matter, and germs like bacteria, virus, and fungus. Cleaners or detergents work by washing the surface to lift dirt and germs off surfaces so they can be rinsed away with water. The same thing happens when you wash your hands with soap and water and when you wash dishes. Rinsing, then drying the surface is an important part of the cleaning process. Sanitizers are used to reduce germs from surfaces but not totally get rid of them. Sanitizers reduce the germs from surfaces to levels that are considered safe for intact, healthy adult skin to come in contact with but may not destroy all infectious viruses. Disinfectants are chemical products that destroy or inactivate germs and prevent them from growing. Disinfectants have no effect on dirt, soil, or dust. These must be removed by cleaners. Disinfectants are regulated by the U.S. Environmental Protection Agency.
So when you buy a bottle of whatever cleaner that you're wanting to use, be looking to see, is it a disinfectant or what is its capability to keep you safe, keep the person on your table safe.
Disinfectants effective against staph are most likely also effective against MRSA. These products are readily available from wholesale vendors and retail stores. Using a hospital-grade disinfectant is imperative for all healthcare provider facilities. Most, if not all, disinfectant manufacturers will provide a list of germs, viruses on their label that their product can destroy. Use disinfectants that are registered by the EPA. Check for an EPA registration number on the product's label to confirm that it is registered. Contact time is the time needed for the disinfectant to inactivate or kill germs to the extent as indicated by the manufacturer. For example, if the disinfectant label says that the product kills 99.99% of germs on contact, you can simply spray and wipe the item you wish to disinfect. If the contact time of 1 minute is in the instructions, this means that this disinfectant will inactivate or kill 99.99% of germs in 1 minute if you follow the instructions, which generally include full immersion in undiluted product. Most instructions will note that the disinfectant must remain wet on the pre-cleaned surface being treated for the entire contact time in order to be most effective, and may include rinsing and drying as part of the action required. Massage practitioners often object to the clinical odors of disinfecting products. So essential oils can be used for odor control, but not approved as disinfecting agents. Any oil that would be used in water is totally ineffective as it sets on the surface of the water and is not in contact with the stones. We have a real hard time because so many people, especially with the stones, are quite earth-based and looking for a way to be green, and I get it, I am too. That's important to me. I want to do whatever I can to enhance the work that I'm doing, but not take anything from Mother Earth that could be harmful or add anything to it. But putting tea tree oil or any other oils that are wonderful antibacterial, antibiotic oils on the surface doesn't do anything in the water, partly because it's going to evaporate too soon. It's going to sit on the surface. It's not penetrating into the water. There's no way to emulsify it enough for it to actually do any good on the stone. So as difficult as it is, we kind of have to step up to the society and the culture we now live in. And modern society has created these kinds of overuse of antibiotics. Now we have this to deal with. So we're having to make some shifts in our thinking.
And with the word stones, you can change that word to any kind of utensil that you use.
Yeah.
Same stuff.
Your malpractice insurance company may not protect you if the product used is not EPA or CDC approved for disinfecting. No herbal remedies or essential oils have been approved by the EPA as disinfectants. So until we're finding what we can to change those laws and rules around to fit, we're just going to have to go with it. So the recommended, this is coming partly from the Stone Massage Association because I couldn't get actual great recommendations from the CDC to apply broad-based enough. So we've taken several of them and combined them. 70% isopropyl alcohol used full strength in a spray bottle can be used to fully cover and saturate the implement. Doesn't matter what it is, as long as it's completely covered. Wipe the item dry with an antibacterial disposable wipe or a clean sanitized cloth. Oftentimes we'll have a roll of paper towels, we saturate everything with alcohol, flip it over, make sure it's completely saturated, all the edges are covered, then dry it off with a clean paper towel, throw that one away and get a new one for the next item because it's easy to pick it up after a while and be passing it. Porous surfaces must first be washed in hot antibacterial soapy water using a scrub brush, then rinse in chlorine bleach. Dilution recommendations are on the product label, then wiped dry, not air dried. Heating and chilling units filled with water or ice must be sanitized and contain a hospital-grade antibacterial agent approved by the EPA. That's kind of where I was surprised at that temperature thing not killing enough of these germs. Any item returned to the heating or chilling unit must be sprayed with alcohol or wiped prior to returning it to the unit. This is MPC is one of the hospital-grade disinfectants that is available easily for us because it's Spa Elegance, which is, I don't know if you guys get that catalog out here that much, but we get it on a regular basis. And this is their website and phone number. EPA and CDC approved, kills HIV/AIDS, human herpes simplexus type 1 and 2, influenza type 1, influenza B, Allen virus, measles virus, and on. Then it lists MRSA as one of them that's killed as well. So it'd be a good idea to consider purchasing MPC from them if you use water to heat any of your products or chill any of your products, anything that you're using. This company sells it in gallon size for about $50.
Yeah, with shipping
and all
shipping.
that kind of stuff.
And it doesn't smell
Right.
bad,
And
you know, it's not like getting a hit of bleach.
Right. And it takes 2 tablespoons per gallon, I believe, is a dilution. So 1 gallon will last you a long time.
Would you use the this in like a sauna where you would be pouring water
Absolutely.
over? Okay.
Yeah, they're using it in manicure, pedicure water, so it's safe on the skin. It doesn't affect anything like that. They use it in all the hydrotherapy places, so it's, you know, it's got a really good kill ratio, and it seems to be easy to work with.
What's it called again?
MPC.
MPC
Spectrum. Yeah. And if you call that phone or the 877 number, can't say 800 number anymore.
Yeah, but it's
SpileAgainst.com, you can get online and order it that way. That works good.
I had a question. Like at my facility, we had showers. Should we be doing the same thing after every person goes in those showers?
in the foot, yeah, where
Yeah, where the feet are.
You can put some of that in a spray bottle
Spray it just like.
and
a big-
spray the, yeah.
And that's
Spray
that
down.
dilution of that 2 ounces per gallon, so a gallon of the spray goes a long ways.
Yeah.
And it is one that's a contact, it doesn't have to be immersed, so
Yeah.
that helps. And there's another company listed there, that Misco Products Corp. They have, in addition to MPC, they have several different kinds. A lot of them are very strong, astringent odors. But they recommend different kinds for like running through the water system for people who are doing high colonics, all that kind of stuff. There are some different ones now on the market.
Did they say any?
Sorry.
Okay. You're gonna go, you're just reading now, you're gonna go through some other stuff for like a one-by-one combination?
Actually,
Or-
we're going to just continue to read through this and then do it through question and answer so that you can get it
I'll
down the
save it.
way that you want to get it.
And
Because,
yeah, we can go back to the screens.
I can save it.
yeah.
No, I mean, I'll just save my question for an application.
Oh, yeah.
Oh,
Okay, okay.
Okay.
Yeah.
Good, good.
Did they talk about the 10% white vinegar solution? Because that kills everything.
That wasn't
That
approved
was
by the
recommended.
EPA.
But, I think there may be a slide that speaks to this, but what we try to do and try to focus on, because I agree, I even know a couple things that I have read that I see no reason why not to use them. Bottom line, it came down to the fact that when you get to court, when somebody shows up with their malpractice insurance on the line, what is going to stand up in court? And it's only EPA approved products. So if it's got the EPA approval on it, then we're good. And that's the first time I've ever taken any of that stuff serious. I'm the one that drove till I was 22 without a driver's license because I didn't think I really applied to me. So I mean, I just stretch as far as I can with this stuff in what I believe in. But all of a sudden, when it gets into court cases and insurance, because when somebody else gets sued because they didn't follow the correct guidelines, my premium goes up. And I'm cheap enough, I don't want that to happen.
Are these guidelines going to be being taught in schools so that they get it from the get-go?
Exactly. We're trying to get this now as part of the course curriculum. We are willing to give it away, and trust me, we spent $25,000 gathering this and can't get anyone to even consider paying us to come and teach it in their school. And I am willing to put it on a disc and mail it to every school in the country as soon as somebody will buy the discs for free. Because
How
it's
much
got
of a disc
to.
all bought?
I don't know. I mean, we just got to figure out a way to burn a bunch of them, find somebody that'll do it.
Right there he is.
Yeah.
Take
Because
care of
this stuff really needs to get out there.
Yeah.
it. Okay, we'll help.
Good, because I've gone beyond the thing of it being a good business idea and a good, it's too, it's
This
important to
thanks
get
all
it out there.
therapists.
Yeah,
Yeah.
because we're having enough trouble with the insurance premiums as it is. We don't need to carelessly let our industry find it.
And I don't want to get MRSA.
Yeah.
Well, the insurance companies might give you a contribution too, because they don't want their premiums, they don't want their premiums going up, they don't want to get
Love
sued.
it.
Yeah.
One more question.
Well, I boil the stones first in between people too. That's
Temperature
not
won't do it.
boiling, won't.
If you boil them in between clients, you're
Yes.
probably going to be using them about a 4-hour stretch between clients because the body of that stone is not going to cool down enough to be safe temperature-wise for the next client. If you did one client a day with stones, possibly boiling would work, but you would need to still have an antibacterial soap in the water. And it wouldn't cover you.
cut the.
So I want to get a couple more here, and then we've got another question. And oh, there we are.
We
now have 3 more minutes.
You've got it.
Now we can start with the 3.
Okay.
Okay, so my question is, so we have a combination of cleaners that are necessary for our stones.
Right.
Okay, so you dip them in a soapy water solution because it takes the oil off.
Okay.
Okay? Then we take that spray of either 70% alcohol or the MPC and spray it.
Okay.
Is that
The way
correct?
it works for
And then
quickest
dry them
and
off.
easiest for your stones is if you put the MPC,
In the
2 ounces per gallon of water, in the heating unit in the morning when you first start. It's good for 24 hours. It'll continue to kill for 24 hours. Now you can maintain the same water all day long, no matter how many times your hands are in and out or the stones are in and out. Then after you finish with that client, spray them with alcohol, completely spray every surface on the stone, wipe it down with the antibacterial wipe to dry it, and it's ready to go back in the heater. So it's really fast. It's not like major stuff.
Okay.
And then
So you don't have to, you can use that water all day long with that stuff in it.
exactly, yeah.
But what about, okay, so then you don't put the stone back in, you just have to have enough stones to keep dragging them on, not repeating while you're doing it.
Yeah, for that client.
To continue.
Yeah.
Yeah, I don't put the stones back in.
And
Is it a-
that's been, excuse me.
Is it a pesticide? Because many of these that they put out
No,
are
it's not.
No,
pesticides.
this one is actually a biodegradable antibacterial agent, which kind of surprised me. And that's why Spa Elegance began to carry it. It started with them for the manicure pedicure industry in order to keep something in there, because they got the little nicks and all that kind of stuff. And they needed something biodegradable because people weren't using anything because they wouldn't use the sanitizers that were hospital grade in their equipment. And that's how they came up with NPC.
So when you take these out, you tap them dry on
No, you're tough. Yeah.
and you put it on your person,
Mm-hmm.
they're not getting this stuff all over them too.
No. I haven't, I use it, I see probably about anywhere between 4 to 6 people a day. And that's a lot on my hands. And I haven't had any skin breakdown, any weird stuff in my body or anything.
I'm transferring it to
So, yeah, so it's
and that
not,
cross-contamination.
yeah, so that, the antibiotic stuff that I put in the water is not affecting my skin. It's
So it
not
wouldn't affect
drying.
yours, then,
You know, sometimes, when you're using a bleach or something and your skin just starts getting weird. No, I haven't.
Part of what
So, that's good.
caused us to settle on the MPC for things is because it is not damaging to the skin now. There's a lot of them that worn right on there. You wear rubber gloves.
Yeah.
Okay,
Up to
that's
here.
going to be real interesting to work on the client in rubber gloves.
And, if I have to wear rubber gloves, what's that poor person gonna do, It's,
That's what I was thinking.
yeah. So we really wanna, we've done, I don't know how many people were involved in the, research on
Guinea pigs.
finding different, looking up different types of antibacterial solution that we can use.
We got stuff we don't even know where to dump it.
Yeah, you have to take it to the
Hazardous waste.
hazardous waste place. I've done that before. And so this MPC, it hasn't hurt me.
And it's
It
EPA
hasn't hurt
approved,
those.
and it's biodegradable,
Yeah.
and CDC approved, so it meets all the criteria for the insurance industry.
Yeah.
Seems to meet all of the FDA approval it's an FDA approval as well, for use on the human body. So by the time we found something that could meet all of that, it's only available in the US, and I teach all over the world. So now we're doing the same thing. We finally found some kind of Clorox tablet that's wretched, but works
Britain.
in Great Britain. And in Japan, they're going straight with the alcohol because we can't find anything over there that has the effectiveness.
So when you put your CD together, you put this stuff on the bottom of it and put your solution at the top so they get the information of how to immediately, and then they can do the read stuff later. Because that's how far they're going to
The
go. Some of them
solutions
will,
at the top.
yeah, some of them will do the solutions at the top. They give you the base information. Okay, and then we give you the blah 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 later. Okay. But this is how I sanitize. This is what I want to know.
We could-
And then I'll
Points list.
read later. It's just like people that turn over their package
Exactly, because they don't
when we
read.
get here because we don't know where we're going.
We actually have, this is a 6 CE approved course through the Stone Massage Association, slightly tweaked with a test at the end.
Perfect.
And so that can be right on the disc with it.
So, and
Yeah.
then you can send it to Mike and me and a couple of others, and maybe we'll
Get
pass
it
it
out
to
to
the
schools.
schools.
Mm-hmm.
Yeah, it's got to get out there.
So it'll save on your mailing, and it'll give them the information they want right away, and it's very cool.
Okay. Okay.
We, just before we go into the temperature thing, well, I have even more complaints about the insurance industry. That's my current soapbox, so please excuse me. I got a hold of several of them and said, you know, this is what we're doing, this is what we're trying to express to the community. We want the industry to have more protection than it has. We figured you might be interested in that. How can we get this information to you in a way that will benefit your clients? And they basically said, we've had no problems with this. We see no reason to really involve anything. They're teaching us in the schools, so don't worry about it. So, you know, they don't realize that some of our schools just are not.
Well, the establishment should have it on hand anyway.
It's,
What you know and what you do, what you different.
Mhm.
exactly.